In this video, we're going to talk all about arm lift surgery or brachioplasty, one of my all-time favorite procedures to do. Hello, my name is Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, and let's get into it. So we're going to talk about who's a candidate, exactly what to expect on the day of surgery and throughout recovery. So patients I see who do best with this procedure, the first group would be folks who've lost a lot of weight, have loose skin there, it irritates them, it hangs and it flaps. And typically we're seeing folks who lose a lot of weight with the new medications such as the semaglutides, that would be your Ozempic, Mounjaro, or through traditional means. And if there's loose skin there, I always say with loose skin, there's only one way to get rid of it. We have to do an incision. If there was another way to shrink loose skin, as plastic surgeons, we'd really be out of a job. We wouldn't be doing tummy tucks, we wouldn't be doing facelifts. So if you have extra skin that's hanging, that's rubbing, that's flapping, brachioplasty is probably going to be right for you. There is another group of patients we're getting a lot more awareness around, and that is folks who just accumulate fatty deposits in the upper arms. And those folks may have a condition called lipedema. With lipedema, people are prone to gathering fatty deposits in the legs, but we also see it in the upper part of the arms too. This is more common in folks who are assigned female at birth. And the problem with these fatty deposits are they're very resistant to diet and exercise. And so in these situations, an arm lift or brachioplasty can be really useful, where we combine in liposuction to get rid of those fatty deposits and lift the loose skin that is left behind. Typically, in the vast majority of cases, in order to contour the arm properly and get the best possible cosmetic result afterwards, I am going to do liposuction. Depending on the patient's gender, we can do some cool little tricks because the ideal male and female arm look a little bit differently. So for example, in folks who identify male at birth, we'll leave deposits over the deltoids, so it gives the illusion of a broader chest. And there's just nice little things like we can do in order to improve the appearance. You're not a candidate for an arm lift surgery if you cannot tolerate a scar. You just have to put a scar there. There are some minimally invasive techniques, but there's very few patients I see who are candidates for this. With those, we're trying to hide the scar in the armpit, but in my experience, that tends to be not a very satisfying procedure. Usually patients who come to me for this procedure have enough skin and extra tissue that we need to put the scar the length of the arm. Obviously, I try to minimize it as much as possible, but in the majority of patients, we're going to want to go all the way. Now, scar position is super important. Ideally, we're going to want to put it medially in the inner part of the arm, which is less visible, obviously, but I favor a more posterior scar as well. So it's definitely less obvious in the different resting positions of the arm. Scar care after this procedure is going to be super important, but as a general rule, we say in plastic surgery, if you have to choose between lumps or loose skin or extra fatty deposits there or a scar, scars, even if you don't scar well genetically, the worst scars do very well with scar care and time. So usually that's going to be the better option for the patient, especially if we've hidden them towards the back and the inner part of the arm. They're much less obvious than loose skin and extra tissue there. And also they're not nearly as annoying as extra skin and rubbing there. One question I get a lot is if insurance will cover this procedure. In 10 years of doing this procedure, I've seen that twice that insurance has covered it, and that was both of those cases were about 7 years ago. So it's pretty unusual. In general, we're just not seeing it. The folks who may get it covered are those two patients that were getting a lot of recurrent rashes that was well documented by their primary care doc, and a lot of irritation from the extra skin. And both of those patients were massive weight loss patients. They'd lost a lot of weight and had a lot of loose skin as a result. So what's involved in this procedure? It's very common in my practice when I'm doing this procedure, I'm either doing a breast reduction at the same time, or I'm doing top surgery or gynecomastia surgery, and those two procedures marry really well together because we're able to harmonize the lateral chest or the side of the chest with the new shape of the arm. So we're not going to have any lumps left behind, no dog ears, anything like that. Typically this procedure by itself takes me between 2 and 3 hours. In the vast majority of cases we're adding in liposuction. I can't remember the last time I didn't use liposuction. If somebody's lost a ton of weight and really doesn't have any fat there, that may be the case, but in general I'm going to use liposuction. We really try and get the arm nice and numb after surgery. I'm not going to lie to you, it's one of the more painful cosmetic procedures, but we anticipate that, we get ahead of it. We give patients usually gabapentin, and Percocet is one of our pain regimens, but we have different ones for different patients. The arms swell after surgery, so we're going to wrap them, and in general we're going to wear compression for the first 6 weeks after surgery. You can take breaks from this obviously to shower, but in general it's going to be good for your final result if you can wear compression. Like I mentioned, scar care is going to be super important. In general, patients who come to us in Miami, Florida for this procedure usually stay with us for about a week. The earliest people go back to work is usually 1 to 2 weeks, depending on their job. If they can work remotely, obviously they can go back sooner. But for strenuous activities, working out, that's going to look more like 6 weeks after surgery. Like I said, this is one of my favorite things to do. We combine it a lot with other procedures, especially in folks who've lost a lot of weight. For example, they may want to combine it with a thigh lift or even a tummy tuck. Sometimes we will do that in healthy candidates. If you think this is something you're interested in, we're now accepting new patients. Reach out to the office.